Well, February is the time of year when all of us are reminded to remember our heart health. Nurse practitioner Yvette Steffens is here to help us explain what all of this means for us. Thank you so much for being here, Yvette.
Oh, thank you, Ryan. This is always wonderful to come down here and be with you. And real quick, I'm going to ask your audience to grab a pen and a piece of paper because I'm going to give you a promotional bit of information that you're going to want to have. So,
and you have a big announcement to make, right?
Yeah, and that's the big announcement. It's a big free offer, and it's worth a lot of money, and it's expensive. So, but we're here today to talk about high blood pressure and high cholesterol. And across the United States, we have really made a tremendous amount in our strides to increase health and modify healthy lifestyles, but still it remains 1 in 3 people have elevated blood pressure or elevated cholesterols. The medical terminology that you might hear is hyperlipidemia. It's a big term for high cholesterols, and or they may have both. 40% of Americans actually have cholesterol levels that remain over 200, and our goal is to find your numbers, and that's what we're talking about today. It's important to know your numbers.
And your family history. High blood pressure runs in my family. Can you give us some tips on what we can do to lower, our risk of being
Fabulous. So those people who have a genetic predisposition of elevated cholesterol levels really need to know their numbers so that they don't build that cumulative effect of cholesterol and find out when they have a heart attack or stroke at age 70, why didn't somebody teach this to me when I was younger? So if you do have that strong genetic predisposition of high cholesterols in your family, you can start testing as early as 2 years of age.
Should you test once a week, twice a month?
Maybe when you're a youngster, toddler, once. When you're 19 to 24 to 40 years of age, 4 to 6 times, every 4 to 6 years. And after that, more often. And that is to find your numbers. We're built differently.
Right.
Our chemistry levels are different. So just knowing what our composition is, what our numbers for each individual is very important.
And you have some free testing for people to come out and take a part of, right?
That's right. So I'm only going to say this just one time, but CVS Minute Clinic is offering an expensive, this is very valuable screening for you. It's a monitoring to test, and this is only on Thursdays in February. We only have 2 more Thursdays left, but you sign in at the kiosk. It's for total cholesterol, HDL, your healthy cholesterol, LDL, your lousy cholesterol is what I teach my patients, triglycerides, body mass index, and also your blood pressure screening too. It all falls together hand in hand. And all of this is to make sure we improve your lifestyle for your future.
And where's the address? Where can people go to find more information?
You can look up cvsminute.com or just come into your CVS Minute Clinic. We have 9 locations between Cincinnati and the Dayton area.
Well, thank you so much for that, and I'll retweet that information. Thank you so much for being here.